Today we will be talking about vaccines, arthritis, breastfed babies, and migraines. You don't need to be afraid. You can handle this, and here's how you do it.
Ask Dr. Mom Show.
Welcome to the Ask Dr. Mom Show, second edition. We appreciate all of the views and the questions and the activity that we have had on episode 1. And so as we go into the questions for episode 2, I would like to share with you what my goal has been over the last 20 plus years as I have gone out and done seminars and classes and lectured. My goal has been to help people wake up and to look around them and to see all of the incredible gifts that were left here by our Creator to help us live long, healthy, active, productive lives. I also want to state in this episode that I am not opposed to doctors under the right circumstances. For instance, if one of my children was hit by a drunk driver today out on the freeway, I would be extremely grateful that I live in this country with the incredible triage care that we have available. However, on a day-to-day basis, there is so much that we can do to take responsibility for our own health and the health of our children and loved ones. So today I would like to take just a couple of minutes to share an analogy that will help you understand where I am coming from and what my perspective is. This analogy is taken from a doctor who lived in the early 1800s. His name was Samuel Thompson. So for those of you who have studied alternative health and healing, you've probably come across the term Thompsonian medicine. Dr. Thompson's analogy was this. He took the wood stove, which was the primary source of heat in his day, and he compared it to the human body. He said, if you put poor burning fuel into this stove, you are going to get very little heat and a tremendous amount of waste. The human body is the same way. If you put clean burning fuel into this body, you are going to have abundant energy and very little waste. However, the reverse is also true. If you put poor burning fuel into this body, you are going to be tired, sick, lethargic, and have very little energy and a lot of waste. Now, he took it a step further and he put 4 chimneys on this stove to represent the body's 4 channels of elimination. In the early 1800s, Samuel Thompson was not aware of the lymphatic system, which is one of our largest eliminatory systems. But going off of the 4 systems he was aware of, we can still see how the body functions. On his first chimney, he listed the respiratory system. On the second, he listed the digestive. On the third, the urinary. And the fourth, the skin. If something gets into the body that doesn't belong there, and the body tries to eliminate it through the respiratory system, we are going to have a runny nose, possibly watery eyes, maybe a cough. We're going to have cold-like symptoms. If the body tries to eliminate through the digestive system, we might have nausea, diarrhea, flu-like symptoms. And the same applies to the urinary and the skin. So if the body is trying to eliminate something, it would stand to reason that we should help it. We should work with it and try to help it do what it is trying to do. Unfortunately, most of us have been taught since we were toddlers that a runny nose is socially unacceptable. So then we begin to reach for the decongestants, the antihistamines, the cough syrups to stop the body from doing what it was intended to do. If we work with the body and we help it to eliminate, a cold should never last more than 24 to 48 hours. However, if we stop it and drive it deeper, then a cold may last 10 to 14 days and quite often go into some type of secondary infection, such as bronchitis, pneumonia, ear infections, that type of thing. So, having gone over that little analogy, let's move to question number 1. And I want to thank my son-in-law, Matt, for coming in, taking time off of work, coming in and asking these questions for us. Question number 1.
Amanda asks, I do have a question on vaccines. What are your feelings on them?
Okay. Thank you for that question, Amanda. We actually have 2 questions on vaccines today. So I will answer both of them and kind of tie them together. The first thing I want to say about vaccines is that I would never presume to tell a parent whether they should or should not vaccinate their child. That's a very personal question. It's something that each parent has to decide for themselves. However, I would strongly recommend that you research the pros and cons of each individual vaccine that you are planning to either take yourself or to inject into your child. And I will tell you from my own personal experience, I have a very large family, and so the first third of my children, when I was doing everything very conventionally, I did vaccinate. The middle third, so the second third of my children, after I started researching and studying what was involved with these vaccines, and I saw some of the reactions from the first third of my children, they got very few vaccines. My youngest children, the third third, have never been vaccinated. So that might kind of answer your question about how I feel. It's interesting that you asked this question for this episode because just yesterday, my oldest daughter sent me a link showing where the Yale School of Medicine just released a paper this month, which is February of 2017, showing a very strong association between vaccines and brain disorders. So again, I highly recommend that you do your homework before making these decisions. Do not automatically do it just because it is the mainstream conventional wisdom. Okay, Matt, question number 2.
Renee asks, what is the best protocol to detox kids from vaccines, including HPV? Thanks.
Okay, I know of parents who have used several methods to help detox or neutralize vaccines. One of the things I have heard parents do is put lobelia tincture under their child's tongue. Another thing I have heard parents do is use a drawing salve on the vaccine site immediately after it has been given to help draw the toxins back out. Again, rather than trying to neutralize them or detox them, my strongest advice is do your homework, decide whether you even want to do this. As far as the HPV vaccine goes, in January of 2016, the American College of Pediatricians published a paper voicing their concerns about some of the side effects of this vaccine. So I would be very, very cautious about ever subjecting a daughter to this particular vaccine until you have done your research. Okay, Matt, question number 3.
Tammy says, what do you suggest for inflammation? Doctors want me to take a steroid shot in my back for arthritis and inflammation, and I do not want to go that route. Please help.
Tammy, my mother actually came to live with me when she was in her 70s because she did start taking steroids for her arthritis and inflammation. Because of the side effects from these steroids, she developed such severe osteoporosis that her vertebrae actually could not support or sustain her weight anymore and began to collapse. And so in her 70s, she could barely move due to the severe pain she was in. She developed pneumonia, and in essence, I took her home to make her comfortable because the doctors didn't think she would live very long. Once she came home with us, we put her on distilled water, fresh fruits, fresh vegetables. We soaked her twice a day in a comfrey bath. We started giving her the Replenish Bone and Tissue formula orally to get comfrey into her system to help rebuild these tissues. And she went on to get out of that bed and live a very active life for another 10 years. So I appreciate your question, and I commend you for looking at alternative ways to take care of this, because you can reverse all of this and live a very healthy, active life. Matt, what is our next question?
Nancy says, I read that breastfed babies can become iron deficient after 6 months. Is that true? If so, what should I do?
Nancy, this is a very good question and a very important one. As long as you are getting all of the nutrients you need, so will your baby. So if you're not iron deficient, your baby shouldn't be iron deficient. You just need to make sure that you're getting all of the nutrition and nutrients that you and your baby need. In fact, to address this concern, last year, I actually formulated a prenatal supplement called Mama Bear's Prenatals to help women get all of the nutrients and nutrition that they need to be able to go through a healthy pregnancy and to sustain them and their babies through the months that they will be nursing. Matt, what is question number 5?
Krista says, hello Sandra, this is my first time viewing your channel and I have really enjoyed it thus far. You have vital information that I will be implementing. I do have a question for you. Do you suggest any brand of water you drink? Thanks, I really appreciate it.
Krista, thank you for that. I really hope that this information will be helpful. What brand of water I drink is kind of a touchy subject. I hate to promote one brand over another because there have been so many problems with bottled water. Here's what I try to do. When I am out running around or traveling, if I can find water that is in a glass container, such as the Voss brand, then I will go with the glass, just to avoid the contaminants that come from the soft plastic. If I can't find a glass container, then typically I go with the Smart Water, because that's distilled water and that's the type of water that I prefer to drink. Thank you for your comments and that question. Matt, what is our last question?
Tanya says, I have been having migraines every day and the doctor seems to think I have sleep apnea, so not enough oxygen to the brain. I seem to think it's something else. What do you recommend?
Tanya, there are multiple things that can cause migraine headaches. And since I'm not a doctor, I can't prescribe, I can't treat, but I can share my experiences with you. The very first thing I would look at if I was suffering from severe headaches is dehydration. If you are not drinking a minimum of 2 to 3 quarts of water a day, then there's a high probability that you are dehydrated, and this can cause severe headaches. The second thing that I would personally look at is increasing circulation. And one of the easiest ways to do that is with cayenne pepper. I would go to a health food store and probably pick up some cayenne in capsule form. I might take 2 capsules 3 times a day because cayenne increases circulation and is also very good for the heart. The third thing I would consider doing is getting a cayenne ointment and rubbing it into the neck, behind the ears, maybe to the temples, because this will bring a lot of circulation to the area, which will help increase the blood/oxygen flow to the brain. We are out of time for today, but again, thank you for your questions, your comments, and we look forward to hearing from you for future episodes.